Despite the $245 billion diabetes-related cost that burdens American healthcare every year, chronic care of this condition has not improved. Patients are still using paper logbooks to track their glucose, and doctors are spending most of their visit times educating patients on the basics of diabetes. That's why we've created CloviMed, a way for patients to take control of their own condition and for doctors to spend visit time treating them more efficiently, creating better outcomes at lower costs. Let's take a look at how it works. Doctors, nurse practitioners, or other medical staff can quickly set the patient up in 5 minutes during their next visit. Patients can also begin the registration and tracking functionalities themselves, as our goal is to bring collaboration between payers and care providers with their patients, being guided with their own data points. After setting up the patient, our medical provider can set the times and days when that patient will receive a text reminder to log their glucose. For example, this physician wants this patient to log their glucose twice a day, 4 days a week. These text messages can be adjusted or toggled off and on as the doctor observes whether or not the patient is adhering to his or her care plan. Medical providers can also promote prescription drug adherence by setting up what dosage and types of medication the patient should be taking, and then setting reminders when the patient should be refilling that medication. Patients will begin receiving text messages asking them about their glucose levels at the specified days and times. After responding, they'll receive a tidbit of information that drives continuous engagement and helps educate them about their condition. We also text prescription medication reminders and ask our patients how many pills they have left to track medical adherence. These data points that the patients are providing will be integrated into our cloud-based system, and as you'll see in a little bit, they will be able to see that visualization trend and take control of their condition. As part of our go-to-market, we hope to integrate with the plans like Independence Blue Shield, so patients can single sign-on from their portal onto CloviMed. After logging in, patients can easily see the data that they texted in graphical form. They can drill in and explore the data to understand why their blood sugar might have peaked or valleyed. Besides getting educated while they track and monitor their progress, patients can take the initiative to watch videos to learn about all different aspects of their condition. Our content library covers everything a diabetic needs to know, from preventing complications to measuring blood sugar levels, and how other biometrics such as blood pressure or cholesterol play a role in their condition. Future versions of our educational module will include quizzes and social sharing to make the experience even more sticky. Patients will be able to share recipes, interesting articles, and connect with folks dealing with the same things that they are dealing with. As patients continuously engage with our tracking and educational functionality, we also give them the ability to understand their own confidence with managing their condition. This survey, following Stanford University's guidelines, help patients understand how they are managing themselves as individuals and how others in their lives are affected. After they complete the questions, they receive a baseline score, which they can continuously compare in the coming months. Finally, to drive improved population health, we help patients understand how they are doing in comparison to others. They can see how others are doing in related to self-tracking, managing complications, and visits to the doctors, overall habits. For example, they can see how many times they've measured their glucose within CloviMed compared to the NHA-NES averages. If there's an area that they don't understand, they can drill in and get further educated within this benchmarking section. All features of CloviMed, including SMS and video content, is available in both English and Spanish. Thank you for watching our video, and we look forward to making CloviMed your one-stop shop for helping your patients take care of their diabetes.